Mark Daly reporting for Paralyzed Veterans of America News online from Summit 2011 in Orlando, Florida.
Hey everybody, I'm Tim Pogo for Speedy TV. We're at the Paralyzed Veterans of America's Summit 2012.
Well, we're here to do a few things. First of all, is sharing knowledge. That's the first foremost important piece of being a clinician. Equipped with knowledge and not able to share with other colleagues that doing the same thing you do, and that's how it began.
I mean, this is tremendous opportunity for all the professionals to come together and discuss issues facing SCID.
Of course, I had the great privilege and honor working under Secretary Mansfield, who is an inspiring individual, but also was a thought partner in making some of the changes in VA that frankly occurred about a decade before what's going on in the country today. VA had to create and demonstrate value. It had to adopt electronic health records. And today, the United States is facing great questions and challenges and value. I think there's a lot to learn from the sort of work that PVA and Secretary Mansfield inspired and led.
Get to bounce ideas off of other people, see what they're experiencing in their clinics and patient population and things that are working for them. And some of the different vendors have been, their technology is in our clinics and other people's clinics and getting feedback. It's nice, it really is.
And these vendors have been great because I walk up to them and all I would say is, tell me what you have and why would I want that? And they're just all over that, because I didn't know about most of what I'm looking at. And so that's been really, really helpful.
This wasn't done years ago. People looked at the basic science and would say, spinal cord injury, how are we going to fix things? We've got damaged central nervous system. We're knocking on the door. It's very exciting. There's a whole variety of methodologies, from cell therapies to small molecules to understanding the unique genetics of aspects that Dr. Waxman Steve works with.
I think that the platform that the PVA provides for us nurses, doctors, it allows all the disciplines to get together and understand each other's complexities throughout the day, throughout the week, and what we're trying to learn about our patients.
And patients with MS can have MS lesions in the spinal cord. In fact, that's also something that people sometimes forget happens. It isn't just in the brain, it's in the spinal cord. And often the spinal cord lesion is causing the biggest problem. So patients with MS can actually behave, and their functions can behave like somebody who has a spinal cord injury. And research in one helps the other. And in both cases, we have a situation where the nerves are damaged. In spinal cord injury, it's by injury. With MS, it's by the disease. And how we can enhance the probabilities of that area of the cord to function better.
The best source of ideas are from the veterans themselves and the clinicians and that work with them and their families and caregivers. And so that's important about being in an event like this.
Well, if it wasn't for the PVA, this wouldn't exist. This and just say the spinal cord injury centers of care, the MS COEs. None of that stuff would have happened if it wasn't for the advocacy that the PVA has had for years and years. And just the incredible investment they put into this financially, time, their staff, they dedicate so many staff to help us put this together. It's just a wonderful, benefit that we all get.
The price really for the conference isn't too bad either. I think it's pretty reasonable, but it was real easy to get a scholarship, and they pay for the 3 nights of room, and I'm fortunate that the VA paid for my flight out here, so it was real easy.
We signed up in Orlando last year, and when we got the email, we were one of the 600 that would get 3 free nights. I was very excited because not only for an opportunity to be on the west coast of America, but also to be with the PVA again, to be able to come to a conference like this and continue to further my education in spinal cord, because this is one of the areas that I really love is our specialized care of our patients that we do. So.
Well, the PVA has been instrumental and very important in the development of the spinal cord injury system that the VA has right now. Their help, their suggestions, their interest, their energy has really been a driving force in developing the system within the VA. And we're grateful for their cooperation and for their help.